Delhi's air quality today deteriorated to very poor category for the first time this season. Air pollution typically worsens during the winter months. Government-run monitoring agency system of air quality and weather forecasting and research has attributed the increase in pollution to stubble burning, geographic location, unfavorable weather, and local sources of pollution. But this time, it could be more serious than you think. According to a US study published in the journal The Innovation, a dip in the air quality to a dangerous low can make the coronavirus more deadly, not only for COVID-19 patients with underlying asthma and chronic obstructive pulmonary diseases, but these patients are also more prone to COVID-19. Researchers say that both long-term and short-term exposure to air pollution has been associated with direct and indirect impact on the human body by enhancing oxidative stress, acute inflammation, and respiratory infection risk, especially long-term exposure to nitrogen dioxide, which might enhance pollution's susceptibility to severe COVID-19 death outcomes. According to the study, 4.6 parts per billion increase of NO2 in the air was associated with 11.3% and 16.2% increase in COVID-19 case fatality and mortality rate, respectively. Moreover, the team found that just 4.6 ppb reduction in long-term exposure to nitrogen would have prevented 14,672 deaths among those tested positive for COVID-19. The team also observed a marginally significant association between PM2.5 exposure and COVID case fatality rate, whereas no notable associations were found with ozone. The researchers analyzed key urban air pollutants including fine particle matter, nitrogen dioxide, and ozone across 3,122 counties in the United States from January to July and examined the correlation to determine the severity of COVID-19 outcomes, including the case fatality rate, which is the number of deaths among people who are diagnosed with the disease, and the mortality rate, which is the number of COVID-19 deaths in the population.